And another controversial drug, and I'm actually going to be speaking about this a little bit later because there was that article or the study that came out about the serotonin theory of depression and kind of debunking all that in SSRIs and the use of that. Right. Can you talk about SSRIs and what are your general feelings about the prescribing of SSRIs for things like depression and anxiety?
I think people feel very badly and they want to fix. And I understand that because I was someone who struggled, not so much with depression, but anxiety. And now I know why. But the thing with psychiatric medications, and I'm going to be very soft when I speak about this because I understand this is, for people, it's a very sensitive issue. But why is it that you have to continuously try new medications? Like, I feel like that's what I've seen with psychiatry practice. Is like, we put a patient on one SSRI, and it doesn't work for them. So then we increase the dose. When that doesn't work, we try a different one. It's like almost playing just whack-a-mole, and never addressing root cause. And people tend to not really, my experience when I was on the SSRI was, it did not take the anxiety away, but I was numb. I was numb to everything. Like, there were no emotions. It was a very strange feeling. And getting off of SSRIs, so that's a whole other conversation, because even practitioners who prescribe them don't realize that you have to taper people off of them. And it's a very difficult process, or can be. Like, they think that you can just discontinue them and go on with life, but people have severe side effects from SSRIs.
Do you have any tips for people if they are on an SSRI, what to do? Is there just the tapering, or are there other things they could be doing in the meantime to help themselves?
I think supporting all the nutrients that contribute to good mental health. So we know B vitamins, we know magnesium, other supplements like L-theanine, which of course then you're starting to get into, like, you're just plugging, you're not taking your SSRI, you're taking L-theanine, but which one's maybe a better option for you? Kelly Brogan has probably the best book. Have you read it? Kelly Brogan's book. She has one of the best books. I was looking at my bookcase to see, I can't remember the name of it. I'll send it to you. That way you can put it, like, if you have some chat notes. But anyways, Kelly Brogan wrote a fantastic book, and she is she MIT or Harvard trained psychiatrist. But anyway, it's phenomenal about getting people off of antidepressants and just nutrients and food and diet and things that people can do, because no one wants to be sad and depressed, but you also don't want to be a zombie.
Well, that's the thing. It kind of dehumanizes you in a sense. And you lose a lot of what it's to be human.
And I think that's intentional.
I think so. And I think, part of the whole thing is, listen, the human experience is an array of things. It's good, it's bad. Depressive moods are there as part of it. But there are better ways, I believe. Sometimes you need an SSRI maybe, or something in that region of drugs. But again, short term, look for, changing and what are the causes of your depression, right? Because obviously it's not always just an imbalance. We're seeing that more and more. This neurochemical imbalance of the brain is being debunked. So what is the real, cause?
What is right? And we can get into the real woo-woo, like, are you living not in alignment with your true purpose? Like, it goes.
Absolutely.
It goes
to me,
really
that's not woo-woo at all, maybe to the pharmacy world, right?
But, it is. But, that's the thing you have to think about. Even I can recall a lecture that I had in pharmacy school with one of our psychiatry professors, who even said, I'm trying to remember his exact quote, but something to the essence of, SSRIs, it's like like a life float. Like, you can get on this and you can lean on it. It's going to support you, but you still have to kick to shore, right?
Yes.
Like, you can hang on to this medication, but you still have to kick and you still have to fight, like, because otherwise you're just lost at sea. Like,
you still got to do something, right?
You still have to do something.
Yeah,
you still have to do something. And so I think like taking a pill, if you need to, again, is fine, but you still need to feel empowered to take control of what you can. And that's a lot. You can control a lot of what you eat. You can control a lot of what you drink. You can control a lot of what you put into your mind through media,
Absolutely.
which is huge.
Yeah.
Like watching the news, I have no idea what's happening in the world right now.
Yeah.
I mean, I know there's a hurricane.
Yep.
But other than that, I'm fairly oblivious. So, and that's really helpful for my personal mental health.
I totally agree. And it's a good
Blissful
thing.
Blissful ignorance.
But it's still not that, because you're selecting what you choose to learn and gain wisdom from with books,
Yes.
with other things, with conversations with people where you put your attention to. So it's not really an ignorance. I would say, like, people like, oh, you're uninformed. It's like, I'm very informed on the things I want to be informed in, but I don't want to be informed in from the media on things that are scary and I really have no control, or I don't even know if it's true or not.
I don't think we were ever intended to be just assaulted with the sheer volume of information that we now have exposure to.
Yeah, no, it's a massive amount. It's too much, I think, for the brain to even work with.
Mm-hmm.
You know,
I read a book recently that alluded to that.
Yeah.
That was like, and it gave statistics, and I can't remember exactly what they were, but like the amount of information that we can consume, you know, in a day, it was equivalent to the information that, say, someone, you know, however many years ago would consume. And it was like months or years. It was like a huge amount of time, which is great because people have access to your podcast and they can make educated decisions about their health. You know, we can get on social media and we can learn things, but at the same time, we were not designed like this.
No. And especially not in such a digital world where we're disconnecting more and more with reality, with nature, with being around other people and going straight into a digital that changes the brain for sure.
It does. We're meant for connection, like with humans. That's how it's supposed to be.